The remaining part of this chapter is pretty straightforward. One of the things that we need to remember about nutrition and how nutrition is affecting the bone tissue is vitamin D. We already saw that vitamin D is important in calcium reabsorption in the small intestine. In the skin chapter, we said vitamin D is produced or synthesized by the skin upon exposure to sunlight. After that, that vitamin D will go to the intestine and it will help in absorbing calcium. That is the main thing I wanted to focus on. Now, part of vitamin D also is coming through the food. Okay? But the main thing is that vitamin D is important in calcium reabsorption. The other thing about bone remodeling and bone tissues and bone growth is the effect of hormones. And in fact, during the lifetime of an individual, there are different glands that are, affecting bone growth and bone remodeling. For example, in the childhood, the main hormone is the growth hormone, and this growth hormone is produced by the pituitary gland. And from its name, it's a growth, so it will promote bone growth, and it does so in several ways. So this is, you can think of it, that's the most important hormone in the childhood that would promote healthy bone growth. After that, or along with that, there is the thyroid gland. Thyroid gland, and we'll see it like in the coming slide, plays major role in remodeling bone and affecting bone growth. In this slide, we are talking about one hormone, thyroxine, or the thyroid gland hormone. This thyroxine affects the osteoblast cells. Actually, it increases their activity, and this would promote synthesis of new bone matrix and bone growth. This thyroid gland role continues through adulthood. Even us in adults, thyroid gland controls our bone growth, or at least bone remodeling in adults. Also, another set of hormones, the 6 hormones, these are during puberty, plays a major role in bone growth. We're talking about estrogen in girls, testosterone in boys. These also would promote osteoblast activities, which will lead to production of new bone matrix, and it's responsible for the growth spurt that would occur during adolescence. When you have like these kids age of 13 to age of 18 or maybe 19, you will say, and you will see their length like maybe goes 1.5 times during this years. That's because of the effect of 6 hormones. Okay. Now, during adulthood, the main gland that's controlling, the main 2 glands that are controlling the bones are the thyroid gland and the parathyroid glands. Now here we need to remember that after adulthood we are not really producing new bones, rather we are just remodeling the old one. So sometimes we need to resorb the unneeded or the damaged or the old bone. All of that is done through the osteoclast, and then osteoblast has to lay down new bone. So there are 2 hormones that would affect both the osteoblast and the osteoclast. These are coming from the calcitonin and the parathyroid hormone. So let's see, and these are coming from 2 different glands. So for example, we have, and this is also much related to the calcium levels. Okay, if you remember, we said calcium levels in blood, this is a homeostatic issue, this is homeostasis, and we said the body would maintain these calcium levels, absorbing them from the bones to maintain good levels of calcium ions in the blood, because calcium, we will see it later, it's important for the muscles, it's important for the nervous system, for the cardiac system. So we can't sacrifice, we can't allow calcium levels to drop in the body. So this is also would explain how homeostasis, or what are the mechanisms for controlling calcium levels, and how these mechanisms are technically affecting the bones, since the bones are the reservoir of bone calcium in our body. So let's move to here. Let's get a new page. So technically we have this homeostatic level of calcium, right? So what will happen if the calcium levels increased? This will be detected by certain cells in the body, okay? And these certain cells would stimulate the thyroid gland. The thyroid gland would respond to the increased calcium levels by producing calcitonin. Okay, now calcitonin will go and target osteoblast cells. Now, if you remember, osteoblasts are going to produce osteoid. Okay, and this osteoid will turn into bone in case of there is calcium. So technically, we are producing osteoid. Osteoid will work as an absorbent for the calcium to make new bones, and therefore this would cause calcium levels to drop. Okay, this is one way. There is another way that is talking to the kidney, and in the kidney to let calcium ions go through urine. Okay, this is one mechanism, but the main one is through the osteoblast cells. So this is in case of an increased calcium levels. What about if there is a decrease in calcium levels? What will happen? In case there is a decrease in calcium levels, then the parathyroid gland will detect and would respond to this, and it will produce the parathyroid hormone. Okay, the PTH is the parathyroid hormone. Parathyroid hormone will target 3 different targets. Okay, one of them is the osteoclast cells. Osteoclast cells, what they will do, they will go and resorb bones, which will cause release of calcium back to blood. Okay, this is one. This is the major one. The second one is the kidneys. Ask them also resorb or reabsorb calcium from urine, which would increase the calcium in the blood. And the third way, into the small intestine, to increase the same concept, absorption of calcium, which also would enhance the levels of calcium into the blood. So these are the ways of how hormones affect bones, and at the same time the homeostasis of calcium. So we said, if there is an increase in calcium levels, the thyroid gland would produce calcitonin. Calcitonin would activate the osteoblast cells. Osteoblast cells would produce osteoid. Osteoid will turn into bone in case of calcium. It means that osteoid took the calcium out of the blood, and this would reduce calcium levels. Another mechanism that the kidneys would release calcium into the urine. However, this is not as important as this one. This is the main mechanism of osteoblast. This is not really wrong. Let's put it as less important comparing to the first one. In case we have a drop of calcium levels, then the parathyroid gland would respond by producing the parathyroid hormone. Parathyroid hormone, it has 3 targets. The main one is the osteoclast cells in the bones. These are going to reabsorb the bones and releasing calcium back to the blood. Then we have the kidneys. They are going to reabsorb calcium from urine and also release it back to the blood. And the third mechanism through the small intestine, which would increase reabsorption or absorption of calcium from food, and this would enhance the calcium levels in the blood and restoring the calcium levels homeostatic or restoring calcium levels in the body. Now, if you understood this, then my question to you, and this is also would appear later, that what type of regulation of homeostatic regulation is this? Okay, so you need to answer this question. So you think how many types of homeostatic regulations do we have, and then which one of them is this process? Okay, now back to the slides. The last few slides, maybe the 2 or 3 slides, are about bone disorders. We have a bone disorder called hypocalcemia. This is when we have very low, extremely low levels of calcium. The bones are going to be brittle. They're going to be soft. Okay, this is could result from poor diet, also to hormonal issues. It could be related to vitamin D deficiency. It could be lack of sunlight, different reasons. That is, they're very similar to the rickets, when the bones of the body are bending due to the lack of calcium. Okay, the other major bone disorder is osteoporosis. Osteoporosis is characterized by decrease in bone mass. Okay, that is happening when we have bone resorption exceeds the rate of bone formation, which means the osteoclast activities are much greater than osteoblast activities. That is when you have osteoporosis. Osteoporosis, it means holes in the bones. Okay, so here we lose the bone mass very quickly. Then the rate of producing a new bone mass or a new bone. Unfortunately, women are most vulnerable to osteoporosis due to different reasons. One of them is the menopause. The other one is the effect, and also it's related to the menopause, to the effect of some of the hormones in their bodies. Unfortunately, there is no treatment, effective or efficient treatment for osteoporosis. The only treatments are managing it, and this would include some of the synthetic materials that would enhance the bone mass, calcitonin, and some estrogen. However, there are plenty of studies that shows changes in the lifestyle, exercises would reduce, quit the smoking, quit drinking soft drinks. All of these would enhance the bone mass, All of these will enhance the bone mass and would reduce the risks of developing osteoporosis in women. Okay, so that's it. These are questions to consider about this chapter. So let me know if you have any question. When we meet in the virtual meeting, we can explore some of these questions you have, and maybe we can go over all of this again. So take care for now.